All right, we'll go ahead and restart our presentation. We believe that we've addressed the audio and that we are unmuted at this point. We will have a copy of the presentation available if anyone needs to get a copy of that due to the delays with the start today. My name is Karen Lawson with Quirk Healthcare Solutions, and we'll be talking about expanded meaningful use, mandates, exceptions, and attestation strategies today. The presentation will talk through some of the payment mandate or the payment adjustments and give information about the new CMS Decision Tool, the proposed rule change, and also some attestation strategy. We are going to begin with just a little brief background on the expanded meaningful use mandates. For those of you that are attending the presentation today, you may be aware that Congress mandated payment adjustments to Medicare eligible providers for not meaningful users under the EHR incentive program. If you need information about the EHR incentive program, it is available on the CMS website. Now, payment adjustments will begin being applied as of January 1st of next year. Providers may be exempt when they're able to show that demonstrating meaningful use would result in significant hardship. We'll talk a little bit about the hardship exemptions today. What you're seeing on this slide now is a table from CMS that demonstrates the cumulative annual adjustment depending on the total number of meaningful users in the program after 2018, and the maximum cumulative adjustment could potentially reach 5%. This particular chart indicates what the adjustment would be, assuming that more than 75% of eligible professionals are meaningful users. Now, on this slide, we'll talk a little bit about Medicare Advantage organizations specifically. There will be audits conducted 2 years after each payment year, and the adjustments will be about 6 months after Medicare Advantage organizations are notified of results. Corrective plans need to be completed within that 6-month period, and CMS surveyed Medicare Advantage organizations that received incentive payments to determine how many of them would be able to meet the 2014 software requirements. They concluded that Medicare Advantage organization providers should be allowed the same flexibility offered to fee-for-service providers for 2014, and that would apply to the proposed rule changes that we'll talk about during today's presentation. Providers under the Medicare Advantage organizations will be able to use 2011 edition certified EHRs or a combination of 2011 and 2014 during the 2014 reporting period if they're unable to fully implement the 2014 edition due to availability delay issues. Beginning in 2015, all eligible professionals and hospitals will be required to report using the 2014 certified edition of their EHR. Now let's take a look at the expanded meaningful use mandates with regard to the May 23rd, 2014 proposed rule changes. So most of you that are attending today have probably read about CMS's proposed rule change to meaningful use attestation for this year. All providers are mandated currently to upgrade or adopt to certified EHR in 2014. Now the proposed rule change will adjust the way that the providers will be attesting, and as we go through this slide today, keep in mind that there has been no announcement of the final rule change yet. In bullet number 2, you'll see that all providers, regardless of their meaningful use stage, will use only a 3-month or 90-day reporting period in 2014. Eligible professionals who first demonstrate their meaningful use this year must demonstrate the 90-day reporting period to avoid those 2015 payment adjustments. The reporting period must occur in the first 9 months of the calendar year of 2014. Keep in mind this is before the proposed rule change, and providers would then attest by October 1st to avoid adjustments. Now, eligible providers must continue to demonstrate meaningful use every year to avoid payment adjustments in the subsequent years. So let's keep going now with the proposed rule change. If the rule change is finalized, it would allow providers to meet Stage 1 or Stage 2 meaningful use with EHRs that are certified to the 2011 or 2014 criteria, or a combination of both. We have a table for you in just a moment to show you how that would work. Now, the proposed rule change is not a blanket policy for all providers. The proposal would only apply to those that can demonstrate that they're not able to fully implement their 2014 edition of their certified EHR. Note that stage 1 objectives and measures are referenced in two ways. This is really important as you're thinking about your next steps. The 2013 designation references the original stage 1 objectives and measures. And then the 2014 reflects changes CMS finalized in the stage 2 final rule effective this year. So let's take a look then at how this might work for your providers that are testing. This is a table that's provided by CMS, and it allows you to cross-reference, if you were started in the left column there, if you're scheduled to demonstrate stage 2 in 2014, you would be able to attest for meaningful use using any of those three methods that you read from left to right. Remember, this is only providers that could not fully implement the 2014 edition certified EHR for the reporting period in 2014 due to delays in the availability of their 2014 update. So as you take a look at this table, you can start to visualize where your providers would fall into these options. CMS has released a decision tool that can help you take a look at which of these options would best apply to your providers. You can see that when you enter this tool, logic tree, you'll start with answering a question about which certified EHR edition you're currently using. So when you look at this slide, you'll see the one that says the word if underneath it. The next logic slide that comes up has to do with what stage of meaningful use you're scheduled to meet for this particular provider in the 2014 reporting period, and you would answer either stage 1 or stage 2. And then the next slide asks you, or presents to you, rather, your reporting option. So it tells you, in this particular case, that for this provider, you'd have the option for 2014 definition stage 1 objectives. Remember, those are different than 2013. And you'd have the option for the 2014 CQMs, which stands for the clinical quality measures. So you can see the link to this CMS Decision Tool, and if you don't want to transcribe this lengthy URL, you can go to the CMS website under Meaningful Use, and you'll see the link there to reach the Decision Tool. Remember that beginning in 2015, all eligible providers are required to report using 2014 edition certified EHRs. Taking a look a little bit more closely at the proposed changes to the Meaningful Use Rule, it would formalize the timeline to extend stage 2 through 2016, and the earliest a provider would participate in stage 3 would be 2017. Again, this rule has yet to be finalized. CMS proposed to revert the clinical quality measure, CQM, reporting requirements for providers attesting with their 2011 EHRs. EPs would report on 6 selected clinical quality measures as they did in previous years, regardless of their meaningful use stage. This is part of the proposed rule change. Providers with 2014 edition EHRs would still report on the requirements finalized in the stage 2 final rule, and providers using a combination of 2011 and 2014 would need to meet the clinical quality measure requirements depending on their stage of meaningful use. Again, this is all proposed rule change. Now, taking a look at attestation, those that are looking at the 2014 definition stage 1 would need to meet the 13 core objectives, the 5 menu objectives from a list of 9 for a total of 18 objectives. Those using 2011 certified EHRs or a combination of the two, they're choosing to report 2013 definition stage 1 core and menu, will want to take a look at the definition of meaningful use that is current. You can link to that again through the CMS website, and we'll have a copy of this presentation available if you'd prefer to link from our slides. Now, speaking to the expanded meaningful use attestation, What changed? Taking a look at that. In 2014 for stage 1, the significant changes are patient electronic access. So here for stage 1, 2014 meaningful use, there's a core objective to provide patients with the ability to view online, download, and transmit their health information. There was also a change to the recording of vital signs that increased the age limit for recording blood pressure, and electronic copy of health information. There was a provision that was removed here from stage 1 for all providers. The clinical quality measures were impacted. There was a removal of the clinical quality measure as a separate core objective for stage 1. Now, if approved, the proposed rules and the exemptions would be valid for 1 payment year. Let me take a step back. When providers are submitting for hardship exemptions, so if you can demonstrate that you cannot comply and you submit the exemption form to CMS, that exemption, if it's approved, is valid for 1 payment year, and there's a requirement for a new application for each following payment year. So you can't be exempted in any case for more than 5 years. Now, the deadline for 2015 hardship has passed. It was July 1st, and CMS is announcing that their 2016 application for hardship exemption is to be published soon. So if you're thinking about, do your providers fall underneath the guidelines to request an exemption or an exception, you'll see over the next 2 slides there are some categories that you would consider if you plan to apply for hardship exemptions. Infrastructure is one of the categories where you would demonstrate that you do not have sufficient internet access or you have barriers to infrastructure like broadband. That you may have some new eligible professionals that need more time to become meaningful users, and there's qualifications for how you do that. That you have unforeseen circumstances like a natural disaster, and there's specific documentation required for that attestation. The exemption can be requested for a lack of face-to-face interaction with patients, that providers may be practicing in multiple locations where they have a lack of control over the availability of their EHR for the majority of their patients. Another exemption or hardship condition could be vendor issues. So in this category, if the EP, the eligible professionals vendor, was unable to obtain 2014 certification, or there was significant documentation of the inability to implement the 24 certification delays. Now keep in mind, we're watching for the proposed rule change to impact attestation for 2014, and then we'll be considering or watching for the CMS publication of 2016 hardship exemption requirements. What you're seeing on the slide now is additional information about requesting exemption or exception. Attestations must be completed for each provider that's requesting an exception, and there is one caveat, which is for specialties. So on this slide in bullet number 2, you'll see that if the provider falls into one of these categories, they're automatically exempt from the 2015 payment adjustment based on data that's in PACOS. And you see the categories for specialty there. Now, regardless of whether an eligible professional passes or receives a hardship exemption or skips or fails stage 1, year 2 performance during this year, 2014, they're still going to be required to move up to the next stage. So an example of this, now this is, keep in mind, prior to the proposed rule change. The current rule is that stage 2, year 1 in 2015, with a full year reporting period, and would not get to repeat stage 1 for a 3rd year. And this is the reason that CMS has come in with this proposed rule change, because so many providers will just not be able to meet that requirement. But the policy was intended to apply even if the Medicare eligible provider is granted a hardship exemption for a given reporting year or skips or fails. So here's a bit of information about timeline. July 21st was the public comment deadline for the proposed rule change. Unlike the way that CMS normally does this, which is where they announce a final rule, they will have to promulgate and coordinate all of the announcement for this sometime prior to the last 90 days of this year. So everyone is eagerly standing by, and if you're feeling like you're on the bubble, just know that everyone's in the same boat with you waiting for this final rule to be finalized. So the questions that are important to ask your organization today is, will your eligible professionals be able to comply with the measures that fall underneath the option for attestation that they are eligible to elect? Will they be ready? You know, what's required for them to get ready? And is your EHR both certified and 100% ready to capture the data elements and report them for your compliance? Also, in the fourth bullet point on this slide, will your state-level registry website be ready with the rule changes in time to support your attestation? And finally, will you have systems and policies in place for things like patient portal, information exchange, secure messaging? So there are many steps that need to be taken to provide the infrastructure, and it's important to take a close look at those options tables now and stay closely attuned to the announcement of this proposed rule change so that you can be successful with your attestation this year. Organizations that have already upgraded to 2014 certified EHRs are being conservatively encouraged to continue with their progress and building their systems as originally planned until there's additional clarification on this final rule. And the basis for that is that progress is important, and any progress that you can make will help accomplish both your 2014 compliancy as well as 2015. We'll go ahead and conclude and unmute the presentation today so that anyone that has questions can ask those questions. We do have a chat box, and a few of the participants today have requested copies of the slide presentation, so we'll make note of your names. And thank you very much for your patience and for listening today on the Insights presentation. We'll now open the mute lines for anyone that has questions and look forward to having you join us for our next Insights. Questions?
This is Jessie from Matheson, and I'm asking, we have a new provider starting at the end of May, and he's never attested before. So, and we are in our second part of stage 1. So
right.
Do we start him at? Do we have to start him from the beginning, or does he just pick up where we're at? How does that work?
Well, for 2015, you would have submitted a hardship exemption request prior to that July deadline. And if you'd like, what we can do is help you clarify some of your options at this point. Could you restate your name and the name of your organization again?
My name's Jessie, and I'm with Matheson Memorial Health Clinic.
Great. Would it be okay if we follow up with you offline and see if we can help you with your strategy?
Sure.
Thank you.
Could I make a comment on that?
Yes.
I had a physician that started the end of last year and 2 new physicians that just started last Friday.
Wow.
And I was told on another webinar that I was on actually with NextGen that I will report stage 1, year 1 with all 3 of them this year. So they have to meet stage 1 criteria, and I'll report 90 days of stage 1 with each one of them, and they're still eligible for the bonus money if I get them in by this quarter, by the last quarter of this year, 2014.
In many cases, that's a really good strategy, and one of the criteria you want to keep in mind is what is that provider's prior history with meaningful use, if any, recognizing that CMS follows the provider history with meaningful use attestation even prior to when they join your organization. So thank you for that comment. Any other questions?
This is Mavis Williams with Retinal Consultants, and
Hi, Mavis.
Hi. Can you please clarify whether we're doing stage 1 in 2014, if that attestation is required to avoid both the 2015 and the 2016 penalty?
We don't, I can't clarify for 2016. For 2014, you must be a meaningful user. And can you state specifically, do you have concerns about not being able to meet both?
So we have concerns about not being able to be a successful attestation by October 1st.
Yes.
So, but if we then are successful, like say after October 1st, but before 12/31, so say we do the last quarter, would we still then avoid the 2016 penalty?
Under the proposed rule change, so if I'm understanding your question correctly, the answer would be most probably yes, you'll be okay. So everybody's just really standing by for this rule change.
So really we don't know if the 2016 penalty is tied to 2014.
We do know in 2015 there will penalties will start being applied in 2015, January 1st, 2015, and it'll be based on whether you're a meaningful user in 2014. So that's why everybody's on pins and needles for this rule change.
Okay.
Thank you. Any other questions? Well, we really want to thank you, everyone, for being so patient today, and I personally apologize for the delay with the audio, and we would like to make ourselves available, so please give us a call or send us an email, and we'll have these slides available. We look forward to helping you and also to having you attend the next Insights presentation. Have a good afternoon. Thank you.
Excuse me, I put a question in.
Yes.
Hello?
Go ahead.
Yes. Our issue with not being able to put in the 2014 version of actually NextGen has been more of an infrastructure. It's not that NextGen wasn't ready, but it's just that we can't run it. We've had just more issues than anyone can even conceive with our different upgrades that would make it necessary or that would make it possible for us to get to 5.8 and 8.3. But my understanding is that doesn't count. It's whether or not the vendor with the software was ready, not whether or not you're ready to accept the software.
There's quite a bit of documentation about what CMS considers to be, legitimate hardships. However, let me ask you a question. Have you gone ahead and did you make that July deadline to request the hardship for next year?
No, because we thought we were going to be implementing this in September, but we haven't done that yet.
Got it. Okay, well, we'd like to reach out to you and provide some additional help as you understand what that documentation might require in terms of your inability, to implement. Would you mind restating your name and the name of your organization?
Yes, it's Lisa, and I'm with Allied Physicians of Michiana.
Very good. So there is some documentation around your question, and we'll definitely follow up with you. Thanks, Lisa.
Thank you. Bye-bye.
And good afternoon, everyone. Thank you for joining.